Hello, I'm John Barrett, and I'm one of the faculty members here at the School of Nursing, and today we're going to demystify statistics. Our topic is intention to treat analysis. So what is an intention to treat analysis, and how does it compare to a per protocol analysis? Well, an intention to treat analysis is pretty simple. Most studies, they randomize people into two different groups, one for the intervention and one for the placebo. At the end of the study, the researchers analyzed the data. Those participants that were randomized to the intervention group were analyzed even if they didn't adhere to the treatment, or maybe they were lost to follow-up. And the people who were in the other group, the placebo group, are analyzed in their respective groups. A per protocol analysis, on the other hand, the results are analyzed based on those who completed and adhered to treatment. So those patients in the intervention group who didn't adhere to treatment or who didn't complete it would not be analyzed in that data. So there are advantages and disadvantages to each of these types of analyses, but in general, healthcare research, the intention to treat analysis is the gold standard. And let me show you why. So the intention to treat analysis helps you kind of analyze data in the real world. Many people don't continue to use medications, or they stop using medications for a various number of reasons. So for you as a clinician, it would be good to know how on average this helps patients, so you know what you would likely see if you prescribe this medication to your patients or this intervention. An example of this are weight loss apps. Weight loss apps, when you look at an intention to treat analysis, you find that they don't actually help people lose weight. And for the most part, that's because using weight loss apps is tedious. People have a hard time using weight loss apps on a consistent basis, and because of that, they don't actually lose weight. A per protocol analysis, though, on the other hand, when you look at patients who actually adhere to the weight loss app and use it on a consistent basis, you would find that patients generally tend to lose weight. And how is this helpful for you? Well, if you had the intention to treat analysis, you know that for patients that you prescribe this intervention to, they're likely not to lose any weight. But maybe if they're asking you about this weight loss app and whether it's going to be helpful, you can tell them that if you don't use it, it's probably not going to be helpful. People have a very hard time using it on a consistent basis, but if you do, you might have a chance of losing some significant amount of weight. So let's look at some of the other things about per protocol analysis, because it's not all bad. So a per protocol analysis is not used most of the time in healthcare research. It's not considered the gold standard, but there are two cases where this is acceptable. One is when you're looking at harms, because when you're looking at harms of, say, a medication, you want to make sure that the harms are associated with people who are actually taking the medicine. The other thing that you want to know is when you're doing dosing studies. So when they do studies, they first look at harms, then they also look at dosing. And when they look at dosing, they're trying to figure out which dose has the best protective effect or harmful effect compared to the adverse events. And so again, you would also want to know only people who are actually taking the medicine and what dose they were taking, so you can make a decision on what is the appropriate safe dose for patients to take. Now, there's a caveat here, and that the intention to treat analysis is the gold standard. People a lot of times say that it's the gold standard, that they're using it in their research, but they're not actually adhering to it. So let's take a look at that. So many authors will mention intention to treat analysis in their methods section. However, when you take a look at the details, they're not actually prescribing to the intention to treat protocol. So you must pay close attention, especially to the methods in the results section. If someone says that they're using an intention to treat analysis, you should dig deeper and make sure that they actually are. We hope today that this difference between intention to treat analysis and per protocol analysis makes it a little bit easier to understand why the analyses that people are using when you read the healthcare research. We hope you enjoyed this little discussion, and let us know if you have any questions.